well developed, which is easier for us as pediatricians as opposed to therapists. Because when the muscles are developed, it's much harder to palpate, percuss, etc., the internal organs. For children, it's much easier. It's always easier to do percussion, palpation, auscultation with children. It's much better to hear. Do you have your stethoscopes?
Yes.
Everybody who has a stethoscope will get a mark today. Everybody who doesn't will not receive any mark until you all bring your stethoscopes. Except the volunteer, because he's a volunteer, right? Stethoscopes. Where's your stethoscope? Where's your stethoscope? Yours. Yours. Where is it? Where is it?
Yeah.
All of you must purchase a stethoscope. It has to be your stethoscope. Stethoscopes are all slightly different. Right? You should train your ears to your stethoscope. Purchase a good one. Right? Purchase a good one right away. Doesn't really matter what kind. Usually, the better ones to hear are the ones with the two tubes. The one tube is usually used for measuring blood pressure. However, there are some one tube ones that are fairly good. Okay? Purchase a stethoscope. You have to own your own stethoscope, not borrowed from a friend, has to be your own. Buy it. It's not that expensive. If you go to a store and they say like 1,000 hryvnias, go to a different store. Okay? That's not how much it costs. Although some people have purchased some for even more that look like they're golden or something, I don't know. Right? But usually like 200 hryvnias, 250 should be more than enough to purchase a stethoscope. Okay, purchase a good one. You're going to be using it. Get used to it, train your ears to it. Okay, if you need to replace it, replace with a similar. Right, so, because if you use a different one, you may start hearing it differently. And then you will be getting confused. Is it a different sound, or is this just a different stethoscope? Okay? So what are we going to start with? We will start at the very beginning. Please lie down. Let's, I don't know, do we have a fresh one right here? Yes. Get rid of that. Get rid of it. Please lie down here. So, first thing we need to know is, one of the first things is how a patient should lie in bed for examination, right, for any examination. The way the patient should lie is his hands are straight, his head is on the bed, not on a pillow. Okay, so if there's a pillow, get rid of it. You want him to be straight. The legs are slightly curved, like this. This is the best position for examining the organs of the abdominal cavity, gastrointestinal system. This will relax the muscles, the musculus rectus abdominis, the muscle that keeps your stomach straight, the one that's the most hardest, the press. Okay? It'll keep it mostly relaxed, so we can have easy access, and we're not confused of whether this is defense, resistance,